Hello and welcome back to Proactive New York. I'm Christine Corrado. With me right now is Nader Pourhassan, CEO at CytoDyn. Nader, great to see you again.
Thanks for having me again.
Nader, you promised us news on your phase 2b/3 clinical trial to treat severe and critically ill coronavirus patients. What's the latest here on that?
So in the past, we said there was 342 patients. Today, we said 390 patients. Some people are getting confused, thinking that maybe that's a typo. So the FDA, once they receive the protocol, they have 30 days to look at it. But because the protocol is under open IND, we can initiate the trial right away. But we always wait 48 to 72 hours for any comments. And one of the comments was make it 390 patients. The primary endpoint is going to be 28 days survival. Secondary endpoint would be 14 days. So we made those changes and sent it to the FDA. It's all good now, and we are trying to enroll patients hopefully as quickly as tomorrow.
Great to hear that you have initiated this trial. I want to talk about some news that also came out today, mainly that you're going to be working with the UK's Department of Health. First off, what is kind of the situation with Prime Minister Boris Johnson? Are you going to be able to help him in any way?
So there has been some people from the government over there are talking to people about getting product. And we also have been reached out to, and we are working to see how we can expedite. Obviously, they have to give us a final go-ahead. If they do, we have vials ready to go in New York in the Montefiore Hospital. We have already arranged for that to be ready in the case. And obviously, a special delivery airplane would be able to take that to them immediately if they decide to do so. We need to get our product to where people give it respect us and say that this could really help. Right now, we have major news for me to announce about the patients who have been involved at 11:45 Pacific time in Fox Business News. But having said that, we have seen amazing data coming out. We're taking patients out of ventilators, some of them, and these are the worst of the worst patients. They have CD4 count of 4 or 5. In the HIV eras, when it was below 200, they call them AIDS patient, and they don't have a very good chance of surviving. These patients' CD4 count was 4 or 5. The hydroxychloroquine and remdesivir, most of these patients took that, and it didn't work. Some of these patients have no other option. And to see them recover, self-extubate, I mean, that's major for us, and we're very excited about it. So we're going to be focusing on publishing immediately in New England Journal of Medicine, and also announcing those data, hopefully, and giving it to FDA very quickly. And we're talking about by the end of this week.
So what does the partnership look like with the UK's Department of Health?
They have asked for the protocol before. We were already working with England and Italy. We just didn't go as fast as we're moving now. So we agreed to give the protocol over there. So the department knows that we have a clearance from FDA United States to go forward with our phase 2. So the safety issues are hopefully have been addressed. That's the main thing for anything like that to be given to anybody. The consent form has to be signed. We also want to have letters to be signed that that we normally do in these kind of situations.
So just going back to my Boris Johnson question, would you be able to help him in any way? He's now in the ICU.
So our scientists couldn't sleep last night. They said that we got to get this to them. But Dr. Paul Madden, the inventor of this product, who even talked to me and said that, this is a great situation that we have with the patients who are in Montefiore right now. Hope that we can reach out to others. And so we want to help, definitely, but we need to let the government of England take lead on that.
Amarex Clinical Research has been a CRO partner for you. How have they been as a collaborator?
Back in 2012, when I became the CEO, the future of this product didn't look very good. And when Dr. David Feigl, the ex-head of FDA infectious disease, came to me and he said, Nader, you move very fast in every aspect, but you need a CRO that moves just as fast as you. And I have a company that their CEO is also from your country. You guys got to meet. And in 2014, we met, And since then, we have done things together that is really, really amazing. Thanks to them for the speed that they have carried through the things that the way I wanted them to go through.
Well, once again, I'm sure everyone appreciates your work here, and hopefully we'll see some positive results from this. Nader, thank you so much.
Thank you for having me.